A lot of you have been following COVID around the world because we are very much seeing large surges of COVID in much of Europe. You can see in the dark purple on this map, in Australia, in parts of Asia. Parts of this world right now look like Chicago did in early January in terms of numbers of cases. The good news is that most of these countries are very highly vaccinated, and we are not seeing those cases in most situations translating into a large number of hospitalizations or deaths. I will tell you that in some parts of the world, Hong Kong being one example, a lot of older people are not vaccinated. There, the surge in cases is resulting in record-breaking numbers of COVID deaths. Surges in general are driven by one of three factors: new variants, and we'll talk about BA2, the subvariant of Omicron, changing behavior as people feel comfortable, as people have more interactions, and then immunity, the combination of vaccine-induced immunity, prior exposure, and recovery from COVID. So when one of these three things change, that's what can result in surges. Vaccines are not the whole story, but all over the world, they make the biggest difference, especially to prevent severe outcomes like hospitalization and death. We are in a good place right now in the US, in Illinois, in Chicago, and I'll show you that data. But I want to emphasize that COVID is not over, and if you are not vaccinated, please take the opportunity when risk is low to get that done. If we have a surge in the future, I don't want us to be like Hong Kong, that is seeing a lot of unnecessary deaths. I want us to be like some of the countries that have 90+% of their population vaccinated and are weathering surges without a lot of severe outcomes. So let's bring us back to the US. You can see we're overall doing well. A lot of the country is in that light yellow. We have passed 80 million cases now diagnosed across the US, and it's not going to be long before we pass our 1 millionth COVID death in the country. But we're averaging just 9 cases per 100,000 across the whole country. Illinois is averaging just 9 cases per 100,000 across the country. And Chicago is half that, 5.8 cases per 100,000 per day. By every single metric followed anywhere in the world, we are at low or even very low risk. The WHO uses a cutoff of 10 cases per 100,000 per day for saying that COVID is generally in control, and that's why the U.S. is doing right now. We are starting to see a little bit of an increase. If you've been following along on our dashboard, we are committed to continuing to update that daily, Monday through Friday. We've seen a little bit of an uptake in cases. We're averaging just 156 per day across the whole city, but that's up from the 130s about a week ago. Our positivity is beautiful, 0.8%. Better than almost anywhere in the country, even in the world. But it also is up just a little bit. It was 0.7% a week ago. We have a stably low number of people in the hospital, 123 folks with COVID in Chicago hospitals, and another 25 in the ICU right now with COVID. But we are starting to see a little bit of an increase. Nothing to be alarmed about, not unexpected, as we've had some changing behaviors, as we're seeing more of the BA2, very much still in control, but something we're keeping a close eye on. This is actually the last update of the travel advisory in the way that you all have gotten used to hearing it, where for nearly 2 years now, we have been calculating what are the case rates per 100,000 and then sharing states that are higher risk and states that are lower risk. So as of today, the 11 states in orange are still on the travel advisory, meaning they're averaging more than 15 cases per 100,000 per day. Just for some context again, I told you Chicago's at 5.8 cases per 100,000 per day, well under that 15. But if you go back 10 weeks, we were at 117. So we've gone from 117 down to 5. Illinois has gone from 227 10 weeks ago per 100,000 per day to 8. The U.S. has gone from over 200 down to 8. We truly are in a good place. And moving ahead, some of you have seen that the CDC is now putting out nationwide county level risk. If the CDC had done this early on, we probably would have followed that same pattern. We definitely want to maintain the travel advisory. We think this helps people understand the risk when they travel and know how to be prepared. But looking ahead, starting this Friday, we will transition the travel advisory to align with the CDC's COVID-19 community levels. So let's remind you what that looks like. The CDC sets 3 levels: low, medium, and high. Green or blue, yellow, orange or red. And when risk is low, like it is here right now and across most of the U.S., we're seeing really limited impact on the system, low levels of illness. Medium, we're starting to see some more impact. We might be thinking about masks. High means there's a lot of COVID in that setting. Risk is high. The CDC recommends indoor masks. And here's what the community levels look like by county map again. So this is one of the differences. As opposed to saying across the whole state there's a risk, what have we been saying for 2 years? Risk is local. Epidemiology is local. And so we are going to be referring to the CDC's advisory. You can see there's just a few areas in the country that are high risk right now. But if there are Chicagoans traveling to those areas of Appalachia or northern Maine or eastern Montana, we want folks to know that risk is high there. All travelers should check this map. We've got it on our website. We'll be linking it. We'll be helping folks understand, if you're planning ahead, where risk might be. We'll call out counties that are in Illinois or around Chicago if they're rising up so that people have awareness. And if the areas are in that medium risk, that yellow, we strongly recommend, especially when you're traveling, think about putting on a mask in public places. If they are high risk or orange, we recommend you wear a mask in indoor public places. That is CDC guidance. And then travelers who are 5 or older, who are not up to date with their COVID-19 vaccines, we advise not traveling to a high risk orange community. None of this has changed. If unvaccinated Chicagoans age 5 or older do travel to those high risk counties upon returning to Chicago, they should follow the CDC guidance, which is to stay home and quarantine for 5 days and take a COVID test 3 to 5 days after return. We also want to just remind all travelers, we've seen leisure travel coming back, business travel coming back. It's amazing. I'm thrilled that it's happening. But I want to remind people that when you travel, you often are exposed to situations that can be a little bit less controlled. So most important, before you travel anywhere, ensure you are up to date with your COVID-19 vaccines, including boosters. Most important thing to do. Bring your vaccination card, but also make sure you've got a picture of that card or you're using an app. Pack a mask. Remember, masks continue to be required on all kinds of public transportation, Lyfts, Ubers, etc., across the whole country, and you may be in other settings. And then think about packing an at-home COVID test. If you get symptoms while traveling, we want you to be able to quickly take a test and know whether it's something to be concerned about. And then during and after travel, self-monitor for symptoms, isolate and get tested. And if you're older and you're diagnosed with COVID, and you make sure you're reaching out right away to a medical provider to see if they recommend you take the medication to prevent hospitalization. Let's talk about variants. So this is for the Midwest, but it reflects what we're seeing in Chicago as well. Each of these vertical lines is a week. And so you can see if you go back 10 weeks or so, a little farther, we were still seeing a lot of Delta in orange. And then we saw in dark purple, the Omicron B1 come in and really be almost all of the cases that we were seeing. As of now, Delta is 0%. We're not seeing any Delta. Other variants, 0%. We're not seeing anything else interesting. All we're seeing right now in Chicago and across the Midwest is Omicron. We are seeing 2 primary subvariants of Omicron. The B1, which is the one that hit us through the surge, is still about 69%. And BA2, which is the one that we're watching and is more contagious than B1, and probably some of what is driving that increase around the world is at just over 30% at this point. In Chicago, we've seen that BA2 doubling about every 7 days. So we do think we'll see predominance, meaning most of our cases will be that BA2 by the end of the month. And if you look, again, the dark purple here is Omicron B1, the original, and the light pink is the BA2. Across the whole country, we're about average in terms of what we're seeing. But if you look in the Northeast there, they're in Region 1 and Region 2, New York, Connecticut, Pennsylvania, most of their cases already are BA2. And we've not yet seen signs of major concern. Like Chicago, we're seeing some increases. Not unexpected from changes in behavior, changes in variants. But at this point, we've not seen major signs like we're seeing in Europe. But what we continue to watch, we'll have a better sense of this, honestly, probably by the end of the month when BA2 will be predominant here. And I just want to highlight that when we talk about vaccines making the biggest difference for severe outcomes, this is showing on the left, those two graphs show Chicago COVID hospitalizations. The leftmost bar is 2020, before there were vaccines. The rightmost bar shows Omicron during 2022. And this is showing, you can see that in 2020, we saw the most hospitalizations on the left, and on the right, the most deaths in Black, non-Latinx Chicagoans. But we saw Latinx Chicagoans also very, very hard hit, and disproportionately so for population. And that's because of all the root causes we've talked about. But if you look at the two on the right on either side there, what you see is that during Omicron, we still are working hard on vaccinating Black Chicagoans, but Latinx Chicagoans are now actually more likely than white Chicagoans to have gotten a vaccine. And you see the difference that that has made, where in Omicron surge, we saw a much smaller proportion of both hospitalizations and deaths among Latinx Chicagoans and a larger proportion among Black Chicagoans. All of Chicago gets hit hard whenever we have a surge. All of these hospitalizations and deaths make me worry a lot, but I worry the most when folks are unvaccinated. And regardless of race and ethnicity, between 88 and 92% of all Chicago COVID deaths have been in unvaccinated Chicagoans. It's the most important thing. And while we are in a relative state of calm, I urge you to get that vaccine now and join more than 5 billion people around the world that have already had protection from the COVID vaccine. Where we look at our milestones, we are making really nice progress here. We have 46 Chicago zip codes shaded in blue here that at least 70% of their population age 5 and over have had at least one dose of the COVID-19 vaccine. You see, particularly on the south side, that is where we are still lagging and still working and putting a lot of focus with partners. If we look at 80%, good progress here too. 37 Chicago zip codes that at least 80% of their population over 5 has had at least that first dose, but you see there are some more West Side communities with some room to grow there. And we've got 5 areas in the city, 14 Chicago zip codes, where at least 90% of their eligible population have had at least a first dose. So that's the Loop, that's 60613, Lakeview North Center, Lincoln Square Uptown, 60645, Rogers Park and West Ridge. Last week we announced 60629 down in the Southwest, Ashburn, Chicago Lawn, Gage Park, and new this week, 60639, Austin, Avondale, Belmont Cragen, Hermosa, Humboldt Park, some of Logan Square. I would love the entire city to be here. As a reminder, you should get your COVID-19 booster now if you're eligible and you haven't. Do not wait for any potential surge. We can put a mask on and have it take effect right away. That's the nice thing about masks. If we start to have a significant surge or there is need to do this, if you're wearing one of the high quality masks, you're getting some protection. If everybody's wearing a mask, that takes effect right away. A vaccine does not take effect right away. So it is too late if you say, I'm going to wait and see, do we have a surge later? Okay, now it's time to get a vaccine. That protection doesn't come until the risk is higher. So if it's been 5 months since your Pfizer or Moderna series, or it's been 2 months since your initial J&J, now is the time to get boosted. They are free and widely available all over the city. You can walk into a pharmacy, you can come to an event, you can check with your doctor. Please do it. And I wanted to announce that as of April 1st, we are making a few changes to some of our vaccination programs at the city. So we have seen a drop-off in demand for vaccines. Not surprising with how we're doing from a COVID perspective. So we looked at our data and we decided that we were going to pull back our Protect Chicago at-home program, the program that brings vaccines to anybody across the city, age 5 and up, no questions asked. We'll bring a first dose, we'll bring a second dose, we'll bring a booster. We are keeping that program, but we're dropping from 7 days a week to 4 days a week. We will continue to offer it Saturday, Sundays, Mondays, and Tuesdays, 8 a.m. to 6:30 p.m. I would like nothing more than to see demand for this spike up so much that we lift it back up, but that's where we're looking at our information. We've also launched a reminder recall project. So our call center staff, who are getting fewer calls in right now, are reaching out. So don't be surprised if you get a call. They're reaching out to about 40,000 patients who we see have had a vaccine or 2 vaccines, but they haven't gotten their booster. They're missing a second dose. We're scheduling them for at-home appointments or otherwise taking care of them. So as of April 1st, we'll be going to a 4-day-a-week schedule. Also, we are changing our eligibility for the $50 gift card vaccine incentives. I know a lot of you have been reading about the federal conversation related to COVID funding and some concerns that there may not be federal coverage for uninsured people to get vaccinated, to get tested, et cetera. We are very committed here in Chicago to continuing to make sure that people can access vaccine, for example, regardless of whether they're insured. But we're looking to save a little bit of money in other spaces to allow us to make sure we can do this. So also as of April 1st, only Chicagoans living in the 15 zip codes that are still less than 70% vaccinated, again, eligible age with a completed series, will be eligible for the $50 gift cards incentives. You see them in blue there on that map. They're across the west and south sides. These incentives have been through our at-home program, CPS clinics, Healthy Chicago Equity Zone events, et cetera. There will continue to be exceptions for certain events. We're working with CPS, et cetera. But if you are in Chicago, you live anywhere in this city, and you want to get a vaccine incentive and, along with also getting vaccinated, this week is your time to get that done. Because unless you live in one of these zip codes, as of April 1st, that goes away. For the at-home program, as long as you have called and scheduled an appointment for first or second dose by March 25th, we will honor that incentive even if the appointment is after April 1st. So now would be a great week to get your first dose, get your second dose, if getting a $50 gift card for your time is part of that decision-making process. Just as a reminder, if you catch COVID, regardless of your vaccination status, you need to stay home for 5 days. You can leave your house after 5 days if you're feeling better, but you must mask when you are around others in days 6 to 10. That has not changed. It will not change anytime in the near future. And I also just wanted to remind folks that there's a second round of the free at-home COVID tests available. If you go to covidtest.gov or call 1-800-232-0233, every home in the U.S., you can get a second set of these 4 free at-home tests. If you already ordered your first set, order a second one today. It took a few weeks for my first set to arrive. It took about 2 days for my second set to arrive. And I want Chicagoans getting these in case there's a surge in the future, I want you to have them. And we are thinking ahead in other ways, too, to have testing access, hoping we'll never need it in a surge, but wanting to be prepared. So now is a great time to get your second set of COVID tests and put them on the shelf or use them if you're having symptoms. And finally, I want to remind you about early treatments. If you test positive for COVID-19, there are both IV and oral medications that can help keep you out of the hospital. We didn't have a lot of this during the early part of the Omicron surge, but these are now much more available. And so if you test positive and you are over 65 or you have an underlying condition, whether or not you are vaccinated, reach out to your healthcare provider. They need to look at your other medications. They need to do an assessment. You need a prescription. But one of the oral medications cut the risk of getting hospitalized by almost 90%. In folks who are high risk. So we're thinking belt and suspenders here. Get your vaccine, please. That's your belt. That's your most important thing to protect yourself. But if you do get COVID and you have risk factors, please take advantage of treatments, because that's how we keep folks out of the hospital. So finally, as always, if you need a vaccine or a booster, you have any other questions, chi.gov/covidvax, or our hotline continues to operate 7 days a week. We've taken almost 500,000 calls back and forth in the year that we've been open, 312-746-4835. And with that, I will hand it over to CEO Martinez.
Thank you, Dr. Arwady. So I'm going to share some latest data for CPS, but prior to that, I wanted to share a couple things. So one is we started going mask optional last week. I was visiting several schools, especially in neighborhoods that had low vaccination rates. And what I could share with everyone is what I saw was the vast majority of our children wearing masks, the vast majority of our staff. I'm very thankful to those families that made that choice. I'm very thankful to families and staff also that respected people's choices, but we didn't see any issues last week when it came to masking. And like I said, the vast majority of our children continue to wear masks. With that, we have been very clear. If we see cases rise, if we see our risk level change based on the CDC, based on our local Department of Health, we will go back and implement a mask mandate. So we've always been very clear about that. But the data I'm going to show you right now is, again, we continue to see very, very good data, very low cases. You can see right now, this is our case count for through the 19th. 107 cases, and this is for the entire week. So keep that in mind. So, you know, what you see with Dr. Arwady is the city for per day. This is the entire week for the entire school district. 107 cases and 58 staff cases. Keep in mind, we always follow the city. So we tend to go lower as the city's going lower. When the city starts rising, we eventually rise up a little bit. But right now, we're extremely, extremely low. And then our quarantine numbers continue to be very low. So even though we are mask optional, just to be clear, anytime we've had any exposures in our classrooms, we do require children in that classroom, if they're not quarantined, to be masked. And then children that come back after their 5th day have to wear their masks in order to be allowed to be back into classrooms. So that has not changed. That's to get in line with both the CDC guidance as well as our guidance from our state and our local Department of Health. You can see the numbers right now that are being quarantined: 351 students, 73 staff. And we continue to test at a very high level. We've been consistently over 60,000, closer to 64,000 now every single week. Keep in mind, when you look at the city's dashboard and you look at the total number of tests, our tests are included in that. So we represent a really quite a large proportion of the tests that are done citywide, and our positivity rate right now is 0.1%. So again, keep in mind, we always follow the city, but again, this, you know, we continue to be at an extremely, extremely low rate. And this is our vaccination data. So one thing that we changed that's new, we are showing both district managed schools and non-district management schools. So over 515 district managed schools, almost about 100 non-district managed schools. These are charters, our alternative schools, our contract schools. The reason we want to show that is we're starting to track that now because we do see on our, for the district managed schools, we do continue to exceed the national averages, even though we still have some schools that have very low rates. 60% of our 12 and up now are fully vaccinated. 46.8 of our 5 to 11 are on their first shot. Again, both exceeding the national levels. We are now also monitoring our non-district managed schools because we're seeing those rates being lower. So we want to make sure that we're working with those schools to make sure that they get access to all of our vaccine efforts as well. You can see overall, fully vaccinated, we now have 123,000 students. For our district managed schools, over 148,000 have at least one dose, and then you can see the numbers for the non-district managed schools. And so if you add them all together, we're pretty close now to about overall about 50% of our district almost being fully vaccinated. And so with that, I will turn it back to Dr. Luna.
Muy buenas tardes a todos. Yo soy la doctora Geraldine Luna, directora médica del Departamento de Salud Pública de Chicago. Y nos encontramos hoy en día para las actualizaciones de esta semana. Lamentablemente, el mundo sigue combatiendo el COVID-19. Estamos viendo los casos en China, en Japón, en Hong Kong, que han sido desproporcionalmente afectados en población de más de 65 años por la pobre vacunación. Esto nos lleva, por favor, familia, si tienen pacientes mayor de 65 años que no han recibido la vacuna, por favor, les instamos ese tipo de protección. Y aquí en Chicago y en los Estados Unidos de Norteamérica, vemos que el Omicron sigue siendo la variante dominante. También vemos que el BA.2, que es una subvariante del Omicron, gana más territorio. Sin embargo, vemos que la presentación clínica no ha cambiado. Responde muy bien a nuestras terapias, a nuestras preventivas para el COVID-19 y estrategias de mitigación. El Departamento de Salud Pública eliminó hoy 6 estados de la alerta de viaje semanal del COVID-19 para aquellas personas que estén buscando viajar. Tenemos ahora Alabama, California, Montana, New Hampshire, Nuevo México y Carolina del Norte. Y anunció que está actualizando la alerta para alinearse con el CDC COVID-19 en niveles comunitarios. Acuérdense que estamos en un periodo de transición donde nuestras métricas tienen mucho más sentido en la predicción y en el planeamiento de las estrategias de mitigación y prevención contra el COVID-19. Entonces, Chicago se encuentra en un nivel superior a la nacional. Estamos en 5.4 casos por cada 100,000 habitantes. Entonces, cuando comparamos las métricas de menos de 10, nos encontramos en los niveles más bajos para lo que es la transmisión comunitaria, y ahora nos movemos a lo que va a ser nuestras nuevas métricas en niveles comunitarios. A partir del viernes 25 de marzo, el aviso se ajustará para seguir la nueva guía del CDC, que designa que los condados de todo el país, como el riesgo alto, medio o bajo, van a ser los que van a estar dictaminando o presentando la data de esa manera. Actualmente todo el estado de Illinois se considera en bajo riesgo, lo pueden ver en verde. Los niveles comunitarios de COVID-19 del CDC son una herramienta para ayudar a las comunidades a decidir qué pasos de prevención tomar en función a los datos más recientes con respecto al COVID-19 y su comportamiento en la comunidad. En el futuro, el aviso de viaje de Chicago se actualizará todos los viernes para alinearse al lanzamiento de los datos actualizados a nivel comunitario del COVID-19 basados en el CDC. El sitio web para el CDC permite a los usuarios buscar condados para identificar el nivel de riesgo actual comunitario. Todos los viajeros deben consultar su mapa. Si las áreas son de riesgo amarillos, considera usar máscaras en lugares públicos encerrados. Si el área es de alto riesgo naranja, se requieren las máscaras en los lugares públicos cerrados y se les recomienda a todas las personas que se congreguen con alto riesgo que sigan utilizando sus máscaras. También se recomienda que aseguren estar al día con sus vacunas. Esa es la orden más importante, la recomendación más importante si está planeando viajar o inclusive para transicionar a nuestra nueva etapa de endemia del COVID-19. Autocontrol de los síntomas del COVID-19. Por favor, si está presentando síntomas, no salga de su casa y hágase una prueba de COVID-19. Consideren pagar una prueba de COVID-19 si está viajando. Y traiga una máscara con usted en todo momento y copia de su certificación de vacunación. Recuerden que hay establecimientos que van a estar requiriendo este método de mitigación de acuerdo al público al que le da servicio. Dado que los niños menores de 5 años aún no pueden vacunarse, en el aviso de viajero de la ciudad quedan exentos para lo que son las recomendaciones de los no vacunados. La tasa de casos diarios promedio de los Estados Unidos está mucho mejor, como mencionamos, que la nacional, con 5 casos por cada 100,000 habitantes. Vacunarse sigue siendo la protección y aquí en Chicago vamos a seguir dando los servicios. Claro, aunque hayan oído la noticia de que las personas que no están aseguradas no van a estar recibiendo muchos de nuestros servicios, la ciudad está altamente comprometido para hacer estas vacunas gratis y los servicios de prueba en nuestras clínicas, aquellas personas que más lo necesiten, incluyendo nuestros no vacunados, refugiados y nuestros indocumentados. El CDPH llevará la vacuna a los residentes a su hogar ahora 4 días para economizar fondos por la baja en la demanda y para asegurar que estos servicios fundamentales se sigan impartiendo en nuestra ciudad. Sábado, domingo, lunes y martes. Recuerden todas esas personas antes del 25 anotarse para que puedan recibir todos estos servicios gratis y garantizar que las vacunas les lleguen a su casa con incentivos de hasta $50 por vacunación. El programa cambia a partir de abril 1. Toda esta información se encuentra en chicago.gov/@ home o chi.gov/@ covidvax o llamando para que una persona en su idioma y en su cultura le atienda al 312-746-4835 y recuerden, familia, gracias y cuídate, Chicago. Now I give the mic back to Dr. Arwady and CEO Martinez.
Thank you. We've got a mic on either side here. If you have questions, if you can please identify yourself and limit it to one and a follow-up. Have a question here?
I have one for Dr. Arwady and for CEO Martinez. Kate Chappell, NBC 5. I'm sure you saw Lollapalooza announced their lineup today. As of now, their website says there may be preventative health measures in place, no solid guidance. Are you going to be working with them on whether or not masks or vaccines will be required, or is that a decision that comes down to them now that mitigations have been lifted?
So the reason you're going to see a lot of that kind of language for large events that are coming all over the country, I think, because it really depends on how we are doing here locally. If Lollapalooza were happening tomorrow, we are in one of the best places in the whole United States. It would be great, no issues. When it happens, I fully expect, obviously, it'll happen, and we're excited for it to come back. Depending where we are, from a risk standpoint, we'll be working with them. You'll recall that last year was really one of the very first times across the country that we said we're going to require vaccination or proof of a negative test at a large event. And there was a lot of question about whether that made sense, whether it was something that we could do, but it drove vaccination for a lot of young folks here in Chicago. We talked to them a lot last year, and I think this year we know a lot more than we did last year. So I'm confident we'll work with them as is necessary, and very much hope and expect that we'll be in a good place.
And just a quick follow-up on that, with BA2 likely becoming the predominant strain, as you mentioned, do you anticipate any other mitigations for other events, not just Lollapalooza, but as far as city requirements as that comes?
So yeah, and thanks for that question, because it's a good distinction. So I share the variant information, but we would never make a change just based on the variants. We would make a change always based on how likely it is when you are out and about in Chicago that you're going to be interacting with someone who has COVID and may not know it. And so I do just want a couple things on that. So the news is very reassuring that people who previously had an exposure to BA1 seem to have a very good protection from BA2. So given that we were hit quite hard as a city with BA1, that gives me some reassurance compared to BA2 coming. Also, as I shared, the data has been, even in places that are having these major spikes where folks are vaccinated, most of places we're not seeing that turn into serious outcomes, which is really good news. But where we do see BA2 take predominance, it's more infectious, so we probably will see some additional cases. If we got to a point where we were, as we've been doing all along, we follow these metrics, we get to a place where we're seeing some increased risk, we might recommend masks, for example, and then if we got to a place of high risk, we would require them, just as we have done in the past. Hope we don't have to do it, but it would be based on cases, hospitalizations, et cetera, not just what we're seeing in variants.
Thank you.
Sure.
And CEO Martinez, if I could just ask a quick question to you about what's happening at Coonley Elementary. You talked about masks having to be re-implemented when there are cases.
Yeah.
So this isn't perhaps unexpected, but I'm wondering if you can say specifically how many students are infected there and how long the mask mandate, if you will, or the mask requirement will be in place for those 7 classrooms affected there.
So we had 15 students that are currently in quarantine. The good news about Coonley, it's one of our larger schools, but also one of our highest vaccinated schools. So almost 90% of our students are vaccinated there. We did have about 40 cases during the month, and we actually did the contact tracing, and it was all outside events. And in some cases, some of those children were together. And so the good news is that the quarantine has been small. We are, because again, they come back after the 5th day, they are required to wear masks. Any other child in the classroom also, we're just having them wear masks out of precautions. We have about 6 classrooms right now that we're putting in those kind of procedures, and that's what you'll see. So in any school, as we're seeing these variants, what we're going to be watching is it might be affecting specific schools, and so similar procedures, actually we're learning with Coonley, is similar procedures will be put in place for other schools as well.
Can I just add something quickly to that? Is that, CDPH looks for always outbreaks of any kind, clusters of any kind. And although that's gotten a lot of attention, there have been a couple of other non-CPS schools that similarly we've seen an increased number of cases. Sometimes it's spread outside, but when we're seeing multiple cases in a setting, that is the time, like I said, the masks work right away. And so those recommendations around putting them on in a short-term way is exactly the approach, and it is the approach no matter what setting you're in. If your workplace has a noted outbreak, we would put those in place in that setting. That's the difference between when you have an issue and you need to kind of do it for an extra reason versus it needing to be the recommendation at the population level.
Hello, I have a question for CEO Martinez. Mauricio Pena with Chalkbeat. You mentioned that you kind of talked about the masking at Coonley. I was curious what metric would have to be reached for a mask mandate to be reinstituted. I know we're looking at BA2, and so what circumstances would lead to masks being required?
Yeah, so we've always been really consistent. We're going to follow the science. And so we are looking directly at CDC guidance. We're looking at guidance from the state as well as locally. And so if we started seeing the risk levels go up on the CDC, I know Dr. Arwady would also be, she would also follow with, having the city being at a higher risk level. It would always be in consultation with Dr. Arwady and the CDPH staff. But at that point, we would consider and potentially we'd put it back on a mask mandate.
Is there a specific number that you guys would a cutoff?
Yeah, I'll ask Dr. Arwady because, again, she's the one that owns the risk levels.
Yeah, I'll address just a baseline. And this is, again, where the CDC has set these relatively straightforward low, medium, and high. And you heard me say that, for example, at medium, we would be making recommendations around masks. At high, we might require it. You could imagine that a school system like CPS, at the time that we made a recommendation, could decide to potentially make that a requirement. People, obviously, any setting is welcome to be more conservative than the requirement. But it's that factor is a combination of case rates, hospitalization rates, and those severe outcomes. And so we are trying to be consistent with the way things are being monitored across the U.S. We, of course, continue to follow all the metrics we've been following all along, and I'm very confident that when we see increases, we know how to monitor those, we know how to look for signs of trouble, and we will continue to keep people informed. And just like we have done in the past, we have the opportunity to do both recommendations or requirements, and we may see schools be more conservative, but not less.
Gettinger with the Hyde Park Herald for Dr. Arwady, please. Hey. Was wondering if you could speak more to the research that's suggesting that prior exposure to BA1 gives protection against BA2, and also just wondered if you could kind of contextualize what kind of protection 2 doses of vaccine gives versus 2 doses in a booster at this point for immunity versus protection against severe illness, hospitalization, or death, and that kind of thing. I mean, it seems
Sure.
like there's a lot of different
Sure.
ways to protect at this point. I wonder if you can speak to all of them right now.
Sure. So anytime there's a new variant or a subvariant, right away, the researchers are testing that variant against, in the laboratory, against the vaccines, against the treatments, making sure the tests continue to detect it. That has all been good news on BA2. You'll recall with Omicron, we lost a couple of treatments that had previously been available that were no longer effective against Omicron, and that's one of the reasons we were concerned about it. But in terms of seeing the protection, that's been real world studies where we've seen, for example, in the Middle East, there were one of the first ones that came out was in Qatar, and the protection was about 90%, even against infection for people who had had BA1 being protected against infection from BA2. And then we've seen that replicated in some of the European countries, even where they're seeing surge. So it's real-time data. We're collecting it sort of as we speak, but it has been reassuring, and I've not seen anything suggesting otherwise. Related to vaccination status. So it is clear that completing your primary series is the most important thing. If you've only had 1 dose of a Pfizer or a Moderna, you have not had the protection that you need, even against those severe outcomes. So the most I worry about people who have had no vaccine, but people who have only had that first dose, I also have concerns about, because in the studies, even with the original variants, even before we're talking about Omicron, et cetera, we saw less than half the amount of protection than when people got the second dose. Boosters are a little more complicated. Boosters are especially important for anybody who is older, over 60, 65, anybody with underlying conditions, and they very clearly, especially in the first 3 months or so after getting the booster, help protect against not just severe outcomes, but also infection. In a long-term way, they add to the protection against severe outcomes. One of the things, and this is where you've been seeing, some of the drug companies are saying, might we have need for another booster, et cetera. It's because they're starting to see some waning of the levels in the blood of the way that we can measure antibodies, for example. But antibodies are not the whole story. And so there has not been a recommendation, I want to be very clear, for an additional booster beyond dose 3 if you got Pfizer or Moderna, or dose 2 if you got J&J. I have not do not intend at this point to get a 4th, vaccine, because I've not seen any evidence that that's necessary. I do think getting the booster, though, is particularly important, and especially for anyone who's underlying. And do I think we will probably need to do another vaccine at some point? Probably. My guess, my hope, is that would be more of a even annual, potentially, in the fall, around the time that we're doing flu shots, thinking about creating something that's good for variants. But we just don't know. And the good thing is the scientists are working hard to try to stay ahead of this, that the evidence on protecting against severe outcomes is absolutely fantastic. And I think the question of boosters, nobody wants to be in a setting where there's repeat. And I'm hopeful that it might be fall before we need to think about another round of vaccination, but we're just going to have to see what comes.
And just to ask a follow-up about it, I mean, you obviously know a lot more. It's just, you're looking at maps of Western Europe right now, everyone went up with the initial Omicron boost, and then they went down, and then they're going up again. It's Western Europe, Australia, and New Zealand are going the same way. I know these places are not one-to-one, but why would the United States be different than all these other countries right now?
Sure. So a couple of things. One is that when you say it's not just the cases that are surging. The positivity in those settings is some of these, we're seeing countries with 50% positivity, 60% positivity, 30% positivity, even like the UK, over 10% positivity. So it's not just that we're seeing cases, but we know there's a lot of additional cases that are still not showing up, but it's showing up as for the great majority of these people, a mild illness, which is different. It's sort of a different pattern in terms of that protection. I'd say the biggest difference is that we, in the Omicron surge here, in the first Omicron surge, we did come actually all the way back down before we lifted masks and vaccine requirement for high-risk settings, et cetera. That was partly because we can tolerate at these low levels slight increases, changes, those changes in behavior, even I would argue new variants to an extent when you're starting at a very, very low risk place. We didn't see any of the countries that are significantly surging with BA2 get anywhere near back down to where we are in Chicago or even in the US. I also think we are testing a ton. And so we are detecting a huge percentage of the cases that we're finding. And when I'm looking at settings that are not detecting it, it tells you there's a lot of asymptomatic or people who are not just getting tested illness too. So I don't have as much concern because we got through BA1 and kind of came all the way back down. But it would be, you have to be humble when you're talking about this. And that's where I think we're watching for that when it gets to be the predominant one, what happens then. But I expect we'll continue to see some increase in cases, but I, at least at the moment, am hopeful and relatively confident that we wouldn't see the, really out of control spikes like we're seeing in some other parts of the world. The last thing I would say is that there were a number of countries, particularly some of the Asian countries, Australia, that were aiming for a zero COVID. And it is not possible to aim for zero COVID in Omicron. It's just not. And so you have a lot of folks who have never seen COVID before at all, have no prior, infection. Now, the good news is most of them got a lot of people vaccinated in the meantime, so they're not seeing the severe outcomes. But that is different. We have never aimed for zero COVID here since probably very early on. I think once we saw there were animal reservoirs, and then especially with the Omicron surge, it's too infectious at this point.
Thank you.
Mm-hmm.
Sarah Schulte with ABC7. Do you believe that the case numbers in Chicago and maybe in the state are much higher than what's being reported because so many people are taking home tests? And is that concerning to you given the fact that that's an indicator of what hospitalizations and deaths a few weeks later?
Yeah, so are there more people getting detected with COVID, that have COVID than are in the numbers? Definitely. Is that any different than it's been at any point through COVID? No. And so we've made some estimates around this, and this has been, this is part of where the CDC, in terms of moving, they've moved away. Case counts are still in there because we follow those, they're important. But in terms of some moving away from some of that cases positivity, it's that, there are a lot of people who are not being detected. But the good news is the things that we follow all along don't change regardless of people have home tests. Do people go to the emergency department, right? Do people, where we're doing this routine testing in schools, in nursing homes, in correctional settings, places where we continue to do testing regardless if folks have symptoms. Those actually serve as sites for us to see what's happening in the community. And CPS, what happens at CPS is the reflection of the community. It's not a different level of risk. And so no matter which of the factors that you're looking at, severe outcomes, routine testing, surveillance, et cetera, all of those indicators are good and very low. So then the true numbers are higher, but you look at cases and positivity together. If we were having a 20% positivity right now, I'd say, our cases are way higher than this. But we have a positivity less than 1%. Like the WHO wants it less than 5%, meaning in the formal system, there are a lot of people getting tested, and we're missing less COVID, I would say, even knowing that there are people getting home tests than we were early on.
The reason why I ask is because you have said all along that if you have symptoms,
yes,
and you test positive in a home test, there's
yes,
no need to go get a PCR test.
That's right.
I know a lot of people, including myself, that did not go get a PCR test,
Yep,
because the home test already says it. So,
yep,
I can't, you don't really think that there's, I mean, there is a concern nationwide on this, that local health departments are going to be blindsided because.
So the first indicator all along, the first one that we see move in a way that we can trust is actually emergency department visits and what percentage of people coming in with symptoms test positive for COVID, because that's a reflection of both severe illness, people who may not have tests, et cetera. We also have been, you know, there is a lot of testing that happens in healthcare settings. So we start to see, you know, you saw that we basically have, I think we've bottomed out in terms of sort of where we are from a COVID perspective, but we didn't just see that in cases or just see that in positivity. We saw those in the settings where we have actually had very consistent testing all along. And when you're thinking about different surges, epidemiologists look as much at those consistent outcomes, the hospitalizations, the ICUs, the deaths, the emergency department, some of the syndromic surveillance, the wastewater, et cetera, that we're working to build up. And so, you know, I do think we are seeing the beginnings of some increase here. The question is, how much will that be? But I am not concerned that in any way home testing limits our ability to see surges. I love home testing because it's available and people can do it easily. And if people are taking action based on that, I do not need to count every case. We don't count every case of influenza, and we have an excellent sense of how influenza is going in Chicago. We do count every hospitalization, we count every ICU, and then we have ways of doing, you know, surveillance and testing across the city, which we also have for COVID.
And then just one follow-up. The United Center, they just announced today that they are no longer going to require vaccinations or testing. Obviously, big event this weekend. So they also, it's mask optional, no masks, no vaccination cards. Lots of people. Any concern over that may become a super spreader event, especially with this new variant?
So, you know, I'll tell you, I was talking to my counterpart in New Orleans, and she said, we just had the nation's biggest super spreader event, in theory, Mardi Gras, where 1 million people from around the country show up to party. And they've not seen much of a trouble. They really haven't, which doesn't mean we are not going to have one, okay? I want to be really clear about that. But while we are at low risk, and we are at low risk right now, as you know, the city does not require these proof, and it is appropriate for settings that are feeling more comfortable or believe their patrons are feeling more comfortable to lift those requirements. As always, like I said with masks, we get into trouble in the future, you know, we might again require vaccination for high-risk settings. But right now, honestly, the news continues to be good. And where people are concerned, I'd encourage you to put the mask on. I still wear mine, you know, on and off through the day, depending on settings I'm in. But there's not a need for a requirement at the population level.
Okay, hello, hi, I'm Maribel González with Telemundo. Dos preguntitas, uno es para el señor Martínez y la segunda para la doctora Luna. Señor Martínez, ¿me podría decir, lo dijo en inglés, pero se me lo podría reiterar en español? ¿A qué punto es cuando las escuelas deciden implementar el uso de cubrebocas, aún así en manera no permanente, ¿no? Como lo hicieron en la escuela elementaria Cundy?
Sí, sí. Bueno, primero, hasta ahorita, si tenemos casos en nuestras escuelas, para niños que están en sus salones, si no están vacunados, tienen que aprender de la casa por 5 días y cuando vengan para atrás tienen que poner máscaras por 5 más días. Esto está pasando hasta ahorita. As I shared earlier, even with our current mask optional policy, anybody who's exposed in a classroom has to be quarantined, and then they can come back after the 5th day and they have to wear masks for 5 days. La pregunta que cuándo podemos cambiar, que no vamos a hacer opcional, primero lo vamos a ver yo pienso en las escuelas y de allí si el riesgo cambia para la ciudad y si la CDC, que es a nivel nacional, ¿verdad? Si dicen que el riesgo está cambiado aquí en el condado y también dice la ciudad que el riesgo ha cambiado, entonces sí vamos a cambiar y no vamos a estar opcional. So as I said earlier, at the national level with the CDC, if they deem our county not to be at a low level, if our Department of Health says that we're not at a low level, we will we'll most likely go we'll remove the mask optional. And of course, that'll be in consultation with Dr. Arwady. Y siempre consultamos con los expertos, siempre vamos a seguir con la ciencia y para nuestras familias todavía pido por favor que se vacunen, es la mejor protección. And as always for our families, we're always going to follow the science, but I still ask that everybody get vaccinated. It's still your best protection.
Gracias. Y para la doctora Luna, si me podría explicar rapidito para nuestra audiencia, se habla mucho de esta nueva variante, se escucha de que quizás hayan distintos síntomas a la primera, no sé, usted me puede explicar, y qué tan más o menos peligrosa es de las otras variantes de Omicron.
Sí, la BA2 o de BA.2 es una subvariante de la Omicron. Entonces es más contagiosa, se piensa que hasta un 50% más contagiosa, pero la severidad no varía. Por eso es que aquí en los Estados Unidos no hemos visto un impacto significativo que nos haga preocuparnos, prepararnos, porque vemos que ha seguido el descenso, aun cuando la BA2 sigue subiendo, vemos un descenso. Así que no estamos tan preocupados, la población aquí de Chicago altamente vacunada, no cerramos la ciudad, así que esa pequeña exposición, a lo que es la inmunización natural por pequeñas concentraciones del virus se ha dado aquí, que no lo hemos visto en China. Y entonces no vemos ninguna particular preocupación. Doctora Arwady. Y los síntomas no son muy diferentes. No hemos visto aumento en severidad, los mismos síntomas, así que nos sentimos reasegurados, ¿verdad?, que esta va a ser la situación. Pero más importante aún, por favor, familia, vacúnense. Es la protección que sigue siendo la más poderosa contra todas las variantes del COVID-19.
Great, thanks everybody. Thank you.